Council members, go to other items. Item 74, receiving a report from the Office of the Mayor President regarding implementation of 1.5 mil ad valorem tax for the operation and maintenance of the Mental Health Treatment Center and the status of cooperative endeavor agreement for the operation of the facility and the makeup of the board of directors for the nonprofit entity that will operate the facility by Councilwoman Don Collins Lewis and Councilwoman Erica Green. Ladies and gentlemen, it's a public hearing. We speak on item 74. Pastor, this is your item. If you want to go first.
Again, Tommy Gibson, pastor of Donaldson Chapel Baptist Church. I speak today on behalf of the Prophetic Voices, a coalition of concerned clergy, to express our concern over the next steps regarding the implementation of the mental health tax. In the past, we have informed Mayor Broome as well as several members of the Metro Council of our concerns regarding the details of the tax implementation. We are in general agreement that such services are needed in our parish, but we want to be certain that the needs of every segment of our community are considered as the plan goes forward. Specifically, we are looking for regular communication between the Bridge Center and the Capital Area Human Services, which is designated provider of mental health services. Also, diversity on the Bridge Center board that not only addresses the socio-political, racial diversity of our parish, but diversity regarding the clinical experience in dealing with various mental health issues. That potential conflict of interest declarations be submitted by board members, that cooperative endeavor agreement that will govern this program will address individuals that are considered to be violent, out of parish residents, and those with outstanding warrants. Further, it is our hope that the cooperative endeavor agreement will stipulate that no public monies will be used for lobbying purposes and that it will be a public document, subject to the regular views of the Metro Council or such governing body as the Metro Council may authorize. We are very grateful to Mayor President Broome for convening an initial meeting between the Prophetic Voices and representatives of the Bridge Center Board and other concerned parties. We believe that our meeting was a good faith conversation and that we expect it to be followed up with meaningful dialogue. In the interim, I stand to make it clear that we are watching, and we hope that all those concerns will be addressed to the satisfaction of the Metro Council before any implementation of the mental health tax be approved. Thank you.
Thank you, sir. I guess I should have asked this in the beginning. Is there, and I asked Councilwoman Collins Lewis, I mean, is there someone that has a report? Because I know the item says a report. So does the mayor's office or someone have a report? Then we can go to the other speakers.
Basically, our report is that we're working right now on the CEA. We should be bringing it back to the council probably within the next 30 days. It's being reviewed, put together and reviewed, and then it'll come back to the council for a vote.
Okie dokie. Okay, I guess we'll go to some of the other speakers. Gwen Knox. Would you like to? Yes, ma'am.
Is she Gwen Knox?
She says she is.
No, I'm not Gwen Knox.
Okay. What about, you can come up and speak, just put your name, I guess your name.
She has to do a speaker's card. You have to do a speaker's
I have a card. I have
Well,
a card.
Why don't you just call it by the order?
Well, that's what I'm trying to do.
Yeah, okay, that's fine. I just was going to
Go ahead.
enter as this chair. I do have
I'm
a
sorry,
card.
point of order.
And your name?
Kathy Cleaver.
Point of order.
She's on the list.
Point of
She can
order.
speak.
I know, but you're supposed to do it in the order that you have the card.
I don't have to do it in the order I have on the card.
I didn't say have to. I said supposed to.
Okay, well, thank you. Everybody's going to get a chance to speak, whether they're number one or number two. Go ahead, please.
I just thought I would start since I was going to give a little introduction. My name is Kathy Cleaver. I'm the chair of the Bridge Center
Excuse
Board.
me.
Yes.
Her name is on the list and the address. Okay, go ahead.
So I'd like to start today first by asking the Bridge Center Board members that are here today to stand. All our board members stand. Over the last several weeks, we've received feedback, as was mentioned earlier, that our board did not contain enough mental health professionals and also was not representative of the community we are seeking to serve. And we agreed with that feedback. As you will see by those standing, we have added clinicians, individuals with the right background and expertise to aid us in the final design of the Bridge Center model, and individuals who have been personally impacted by behavioral health challenges through their experience or the experience of a family member or friend. When we started the Bridge Center nonprofit, we examined models across the country to learn about the best practices in crisis stabilization for individuals with behavioral health challenges in crisis. Our search led us to San Antonio as the first model of its kind in this country. With the help of Dr. Jan Kosowski of the Capital Area Human Service District, we worked with local stakeholders to design a clinical model with the best of San Antonio and the local context of Baton Rouge, including the successful mental health emergency room extension that used to operate at Earl K. Long by the Capital Area Human Service District. We have a business plan that outlines our proposed services, a mobile assessment team, behavioral health, respite, crisis stabilization, sobering detox, and ongoing case management. This business plan identified the staffing model we will need, including clinicians and mental health professionals who specialize in this type of service. We have established committees through the board that will ensure that we move forward to address the needs of the committee. This includes an operational committee to research and finalize details of the operational model for the Bridge Center, a finance committee to hire professionals to support our business development, as well as ensure best practices in financial management, and a community relations committee to develop community updates on a regular basis and to respond to any community concerns or ideas. We still have several months before the Bridge Center will be operational in East Baton Rouge Parish, and we intend to spend that time working with you and the community as we make policy decisions and work through the details of getting the center up and running.
You please wrap it up, please.
Yes, I want to be clear. We pledge our desire to be transparent, community-oriented, and focusing on serving those in the community that are most in need.
Thank you, ma'am.
Thank
I appreciate it. Gwen Knox, please come on down. Is there a Gwen Knox?
My name is Gwen Knox, and I'm a board member. I have been an advocate of the board, the Bridge Center, from first hearing about it and knowing how much it was really needed here in our city. I was grateful to have been asked to be a part of the promotion of the mental health proposal for election in November, and was greater gratitude that I had when was asked to serve on the board. This will give me an opportunity to see at a front row seat and witness how loved ones suffering from substance abuse and mental health disorders are cared for and saved. Even though I lost my middle son, Brian, to heroin overdose December 30th, 2015. And he's not here to be able to utilize the services of the center. I will have the opportunity to observe the care that's being given to others. This thing is personal with me. I was catapulted into the public eye after writing an obit letter for my son. And I became the face and the voice of families suffering from loved ones addicted to alcohol and drugs. I seem to have the ability to walk, talk, and grieve the death of my son all at the same time. I have become a concerned, passionate community activist working in this space as a Bridge Center board member. As a member, I will work closely with the leadership team to ensure that proper protocol and procedures of the final CEA are developed and implemented. This platform was thrown into my lap, and I plan to use it to first honor my son, Brian Knox, who lost his battle with substance abuse, and second, to be the voice whenever I can for those who are still weighing the battle with substance abuse and mental health disorders. Presently, I'm the Southeast Regional Lead Facilitator for the support group PAL, Parents of Addicted Loved Ones. I facilitate support groups and mentor other facilitators in 7 states. Also, I recently came on board with the Capital Area Human Services to help create and facilitate a grief support group for those who have lost someone to substance abuse. The support group will be up and running soon and free of charge to the public. The public will be notified of its start.
If you could please wrap it up, please, ma'am.
Sure. The Bridge Center will accept patients as walk-ins, those brought in by loved ones, as referrals from other providers, and also some encounters from EMS and also law enforcement.
Thank you, ma'am. Your time's up. You have 3 minutes.
May I have another?
No, ma'am. Sorry. Next up is Dr. Bo Clark.
Good afternoon. I'm Dr. Bo Clark. I'm the East Baton Rouge Parish Coroner. And my role as the coroner when it comes to my mental health jurisdiction is taking care of the sickest of the sick. And what does that look like in this parish? That's almost 10,000 Baton Rougians last year that required our office and our services for the mental health issues they have. And I think the Bridge Center is now going to be the solution to our mental health crisis, or at least one of them in our community. Certainly, you'll hear from a lot of people that agree that it is what is needed. It's what is needed to help people. And now we're in a position to make it happen. And ultimately, what it's going to come down to is saving people's lives. So I think everybody here in this whole room would agree that's what our goal is, and that's where we need to proceed and make it happen. Thank you very much.
Thank you, sir. Tanya Miles.
Good evening. My name is Tanya Miles, and I'm a board member of the Bridge Center, which I'm honored to be a part of. I'm also a licensed ordained minister. I'm presently a pastor at Love Alive Church. I'm a vet. I'm a peer support specialist. I've been in recovery for over 37 years, and I also have a diagnosis of mental health, which is PTSD. First of all, I just want to thank the people who brought this to the attention of you guys. One lady in particular, she knew who she is, who wanted to make sure that there was diversity on this board, that wanted to make sure that people who were qualified to be on this board. And I'm grateful that I was chosen to be on this board, not because of just the color of my skin, which I love, but because I truly love people with addiction and destructive behavior. Like I said, that is me. I work every day. I get up every day to do that. I never forget a story when Dr. Jan Kosowski wanted me to do some work for her on a contract, and she asked me where she wanted me to help her bring in more clients. I'm like, I know where your clients are. Your clients are in parish prison. I've been doing work in parish prison for over 15 years. And so I set up a meeting between her and the warden, and now you have things going on to help people with mental health issues in prison. Most of them shouldn't be there. They should be at home. They should be at other places. But the way they got there was a little challenging. And look, I've been there. Like I said, 27 years ago, I was diagnosed with PTSD, and I had never had a PTSD episode, and I did a couple of years ago, and the police had to be called out. And so my family thought it was very important that they get law enforcement involved because they thought that I would be a detriment to myself. And so when law enforcement came, because I trained CITs, which will be a part of the Bridge Center, which is the coolest thing, that not only will they send trained CITs out, but they will also have mobile teams that will go with them as well to be able to assess where a person needs to go, what their needs are. Because a lot of them shouldn't end up in prison. They should be able to go to a place where they can be stabilized like the Bridge Center. So the short of the story is that when the police, when I got home and the police were there were 2 police officers, and I had the wherewithal in myself at the time, and I came to myself and I asked one of them whether they CIT trained. He was very nice and cordial. He wanted to de-escalate it. The other one who I asked, and he said he wasn't, he was very rude and ugly. And because I can go in PTSD mode like this, it almost triggered me to do that. And I probably would have ended up in jail, but I did not. I ended up going to the place where I needed to be, and that's a hospital. But I could have went to a place like the Bridge Center and been stabilized, which most people in our community definitely need that, because a lot of them they're offered their medication. They don't know how to take care of themselves. So we'll be able to do that. We'll be able to offer them the help that they need and stabilize them to get them to the next level of care that they need. So I'm in favor of the Bridge Center, and I'm super excited to be a part of the board.
Thank you, ma'am.
Thank you.
Jan Kozlowski.
Hello. I just wanted to say a bit about my experience with stabilization units. I run the Capital Area Human Service District, and I've been the executive director for 22 years, so some of you may be tired of seeing me, but I'm still working the work. And I just thought back that my work with stabilization units really started in 2006, post-Katrina, where we worked together as a community, about 70 different organizations, advocates and clients, people who needed help, to design the mental health emergency room at Earl K. Long, which we successfully implemented. And unfortunately, after 2 years of proving how good it was, it still wasn't kept, and it went away. And since that time, this community has been experiencing exactly what we saw prior to it, and that is more people going to the emergency department and more people going to jail. And so my commitment has been for this community to have a stabilization unit. Like I said, I designed one back in 2006 that worked. I was asked to come back and redesign it with what's now understood about crisis stabilization in 2016, and pulled together a group of clinicians as well as people that worked in M here to design an updated model that really is state-of-the-art. And now I'm on the Bridge Center board. The model that was designed locally by local professionals is what the proposed Bridge Center looks like. The Bridge Center is a part of a continuum. It's not the answer to everything. If all we have is a crisis stabilization unit, all we'll ever see is people in crisis. So it's important that I think people understand that this center needs to be connected with other existing services, and that is the plan. It can't stand alone, otherwise we really won't be making the inroads that we had hoped to make. I just wanted to bring to your attention, I know there's some concern about public and private dollars. My budget at Capital Area over these many years has been anywhere between $30 million and $26, depends on who was governor at the time. And so I know and understand that when you can make things work easier by working with other partners, that's what you go after from the very front, because there's always going to be a lack of funding. And so I know that there's a lot of concern about the Bridge Center using public dollars, but I do want you to know that the budget that I've had, I've always had private partners. I have a private pharmacy to ensure that people who need medication get it easily. I work with the Baton Rouge Clinic. I have social workers that are there. And so this isn't a new concept, that it's been in place. People have accountability measures that they have to measure up to, and I would expect that's exactly what you'll expect from the Bridge Center.
Thank you, ma'am. Hiller Moore.
Good evening. It's a pleasure to be here. So the whole idea of this Bridge Center and the work that we will do is really foreign to me as the DA and law enforcement. And it's unfortunate that it is, that we haven't been in this position to be able to recommend people and have people go to this type of treatment center before. So we're really excited about having this. Our goal is to divert all of these folks that are suffering from mental illness and having issues that are acute at the time to not be taken to prison and not be taken to a hospital emergency room, but be taken to the Bridge Center. We hope that it diverts all of these individuals who are mental health patients and are not criminal defendants. We hope that it diverts them out of the system. We are not trained, police are not trained, sheriffs are not trained to treat these individuals. Hospital emergency rooms are actually not even so, but we believe that the center that this parish will set up will do that, and this is not an extension of law enforcement. We will allow everyone to come into the Bridge Center, whether they commit a violent offense or not. That, the intake will obviously be from the police officer. If there's a violent crime that occurs, depending on who the victim is, that person could be possibly taken to the prison, but the goal is for everyone that's available to go to this center and to be treated. My understanding is there will be no criminal record run. That is, if you have a criminal record, an outstanding warrant, you're not going to be turned away. But we will not be running criminal records. People are just going to be open in. Everybody will be allowed to walk in or be brought in. We would anticipate if someone did have any criminal justice issues that some trained counselor would then reach out to some other third party in law enforcement and resolve that issue for them. We feel and we know that at the DA's office that when we have a defendant who's been charged with offense, if their victim, normally in these cases is a family member, if they're satisfied that their family member has got treatment, those charges will then go away, and that's what we see often. So we hope to get to these folks early on and get them treated correctly. I also want to say thank you to Tommy Gibson and Reverend Tommy Gibson and the prophetic voices. I believe that from the meeting that they generated through the mayor, I believe that we learned a whole lot. We learned a lot of their concerns, which were actual, real concerns that maybe had not adequately been addressed before. And I think that their meeting with us is going to make this Bridge Center much stronger for the citizens of Baton Rouge. I think that Baton Rouge is going to be proud of this effort. Thank you.
Thank you, sir. Michael Mitchell.
Good afternoon. I'm Michael Mitchell. As a new board member and the Chief District Public Defender for East Baton Rouge Parish, I come before you to give you my commitment to ensuring the efficacy of the center. The East Baton Rouge Parish Public Defender's Office represents the poor, men, women, and children of this community who are charged with a crime and cannot afford a lawyer. Many of the clients that we represent would be better served by treatment and mental health services than being processed through the criminal justice system. The Public Defender's Office, working in our office's bond unit, which was created with funds through the Mayor President's recast grant, have worked closely with the Bridge Center on the pretrial release program. In partnership with the Bridge Center, those individuals have been arrested, who've been arrested with a behavioral health challenge or diverted out of the prison and into a treatment program where they can be better helped. We have worked hard to develop a model that best serves the individuals involved in the program and to increase the number of people successfully completing treatment and returning to the criminal justice system. Just as we have with this program, our office will work closely with the community and key stakeholders to establish effective policies that will best serve the people seeking the treatment. As a board member, I assure you that I will keep close watch on the fact that that the center does not turn into something that is an incarceration program, but to help people be diverted from the criminal justice program and to get the services that they need. Thank you.
Thank you, sir. We had Chief Paul listed, but I think he's not. I think he had to leave. Okay, ladies and gentlemen, the public hearing. Anyone else, wishes to speak? Reverend Anderson.
Good evening. I want to say three things. First of all, there is no question there will be a mental health crisis stabilization center. That's not in question. The taxpayers, in fact, approved a tax on December 8th. Our question and our concerns are specifically both the process and the provider. And again, there was no named entity in the tax proposal that was passed by the taxpayers. I know for a fact from the over 20 plus meetings I've had since our last meeting, very few, if any, of the taxpayers were under the impression that they were getting a nonprofit that had no background whatsoever, that was not going to serve children, that in the forest parts of the parish, the Baker, the Zachary, the central areas, that there was no plan that had ever been presented for the taxpayers to decide on. And so our concern is not that we're going to have something awesome. We believe that the taxpayers have spoken. We're going to have something awesome. But there's proper and in order. And we firmly believe that this Metro Council, which put a proposal that was a to-be-named entity proposal, it did not name the Bridge Center for Hope, which is a fully created entity by BRAF, which has no track record on anything literally other than getting that tax proposal and putting some ads. We believe there needs to be a process for an RFP. We need to believe that everybody that is part of that center is not just vetted to the public, not just in private meetings, not just in small conversations. I cannot tell you the number of people we've spoken to. Yesterday we had a lunch and learn for which all of you were invited, and I apologize none of you were able to make it, but one of the people there was one of our finest citizens whose husband suffers from Alzheimer's and is in late stage dementia. And she shared her experience with law enforcement coming out and saying, I'm going to take care of myself first. I just need you to know that. We know that we have current and existing lawsuits with both our Sheriff's Department and our Baton Rouge Police Department, and yet we want to put those folk who have their own houses that they need to concern themselves with on a board for a mental health facility. And what I will share with you is that I don't know about all of you. Most people have family doctors if you have insurance. But if your EKG is wrong, I believe you expect to see a cardiologist at some point.
If you could please wrap it up, please. Your time's up.
Yes. Our concern initially was about transparency and accountability. Speaking on behalf of the taxpayers, I am so proud of this parish for what it's done, but I firmly believe that an RFP needs to be issued by this council.
Thank you, ma'am. Ladies and gentlemen, it was a public hearing. Would anyone else like to speak on item 74? Yes, sir.
I listed too.
Okay. Just give me your name and address for the record, please.
Garrymon, 755 Arlington Avenue. And some of the things that I had written down, let me see if I can. Well, I'll just. The biggest thing I have, a couple of questions I had. One was mostly about funding because the business plan for the proposal. I think that the substance abuse and mental health facility that we have envisioned in our city, the millage that is provided does not provide adequate funding, and certainly the proposal that we want in place for the city, I think, is even bigger than the Crisis Stabilization Center that even the Bridge Center is contemplating. Obviously, they're looking for outside funding. We're looking for outside funding, and so the CEA that I hope that when we are preparing a CEA that we're asking that the provider show what other funding will be in place by the time the CEA is signed, that funding is already in place. Transparency is something that we've already, I brought up. I think when Councilman Hudson asked last time that we defer it to today, quite honestly, I think the idea was that there would be a report by now, or some questions answered by now. So I think probably what's going to happen is that we're ultimately going to defer until there actually is a report received so that we can have this question. The only other thing, I don't know how much time I have left.
1:18.
Okay. A housemate of mine went to a funeral this week on an overdose for opiates. I think I knew of 3 opioid or heroin-related overdoses just this week alone. There were more overdoses, I know, in 2017 than there were homicides, total overdoses. So there's mental health issues, but, you know, I'm coming at it from a substance abuse perspective and not just at it from a diversion perspective. But I know in we do not have enough, not just stabilization, but we don't have enough inpatient treatment. The San Antonio model does have an opioid treatment center. I think we need to look at having in this substance abuse treatment that we have a 28, 30-day treatment center, that funding includes actual treatment center and outpatient services that go beyond crisis stabilization, because otherwise we're going to continue to have the deaths that we're having right now.
Thank you, sir.
Thank
Appreciate it. Ladies and gentlemen, the public hearing, we speak on item 74. Anyone else? Seeing none, the public hearing is closed. Councilwoman Fryeburg.
Well, first of all, I want to say I think this is the most exciting thing that's happened in this parish in a long time. And the overwhelming support lets me know that there are so many people in this parish who appreciate that. I don't think it would have happened without the support and the advocacy of our coroner, Dr. Clark, our district attorney, Hiller Moore, Kathy, Jan, Braff. This is so important to our city, and I'm very appreciative. And I'm appreciative to you, Reverend Gibson, for working with the mayor and bringing some other folks on to the board. But I do have a few questions, and Kathy, if you don't mind coming up, because this is a report, right? So, I have really three. Number one, there was mention made that Braff didn't have any track record with this kind of issue. But I believe there has been a pilot, and you've been involved in that, correct?
Well, again, Braff gave initial funding to do a study. We did a study initially, and Braff-funded study prior to the creation of the board. Worked with, as Jan said, and she can tell you more about that initial development, worked with both HMA, which was the report, as well as we did a follow-up study with Emergent Methods to, again, make sure this was the right model for this town and for this parish. And again, working with groups of providers throughout the city. Numerous providers throughout the city took part in that. And again, while we're not an entity that has run a crisis stabilization center, we are an entity that does have lots of experience. I was the former Assistant Secretary of Behavioral Health. Lots of experience, and again, Jan's experience in terms of running a crisis stabilization center. We believe very strongly that with the help of the outside experts as well as our board, that we do have the expertise to know what type of model will work. Again, with community input for this area.
You said something about in 2 months, you hoped, or 3 months. Did someone say? No,
it won't be that soon in terms of
trying to begin it in any way, shape, or form.
No. We still have a lot of work to do in terms of developing a model, looking for
maybe that's what you said you'd bring us into.
Yes,
okay. I misunderstood. I was just too hopeful.
Developing whether it's a proposal request or a solicitation of. We are right now have an operational committee that is talking to providers that do this throughout the United States, as well as providers here in Louisiana that are interested in doing these type of services, to come up with exactly what type of services we want, line those up, and then determine what providers can do that for us.
And my third question is, I had heard that there had been some members added to the board, and I'd heard some names, and then I'd heard there had been some members taken off of the board. And one of the members I'd heard was taken off was actually still on. So how many members are on the board? I mean, can you name them?
Yes, I can. I hope I don't forget anybody. There are currently 19 members on the board.
Okay.
And
so you didn't take people off, you just put people on? Or
both.
You did both.
Okay. We did both,
okay.
Again, to try and get the expertise. The board we initially developed was more about trying to get the tax passed, and that was our focus. Mm-hmm. And as again, with input from the community, it was clear that not only did we need more diversity, we needed more experience, clinical experience. So we looked for individuals that had those qualities. And so we now have 19 members. 40% are African American. We have again, I'll try and name everybody. I'm just worried I'm going to forget somebody, but we have.
I'm sure the board behind you will
correct. Okay, so let me start. We have Hiller Moore, who's the DA.
He's the one I'd heard was off, so I'm just glad to hear he's on. Don't want you off.
We have Bo Clark, who is the coroner. We have Denise Dugas, who is with Our Lady of the Lake. We have Angie Clocher, who is with Baton Rouge General. We have Chief Murphy Paul. We have Dennis Grimes with the East Baton Rouge Parish Sheriff's Office. We have Tanja Miles, who you met earlier. We just recently added Dr. Marjorie Person, who is a psychiatrist with lots of experience in the area.
Excuse me one second. Councilwoman, yes. You want your additional 5 minutes?
Yes, please. I needed to get permission to get my other 5 minutes.
We have Chris Nichols, who has worked in the housing industry. Worked with getting housing, low-income housing, as well as numerous other qualities she has. We have Collis Temple, who has worked for many, many years, working primarily both with developmental disabilities. Oh, thank you. With developmental disabilities, as well as he works with the forensic population, working to get people out of institutions and back into the community. Let's see. Oops, thanks. Gwen Knox, who you met earlier, community advocate, parent of a child. We have Michael Mitchell, who you also met earlier, the East Baton Rouge Parish Public Defender. We have, who did I miss? Chad Guillot, he's the Emergency Medical Services to help us in terms of making sure we're training people in emergency response. And did I miss anybody? Gwen Hamilton, don't believe I said her yet, Gwen Hamilton, and Marianne Sternberg. Gwen Hamilton also has experience working with individuals with mental illness as well.
So I have a few minutes left. Is there anything that you weren't able to put in your report that you would like to tell us at this point, particularly after you've heard the conversations and
again,
concerns?
I think the big thing that I want the council to understand and the community to understand is that, we will be as transparent and accountable as we can possibly be. And I am committed to making sure that everything we do is available for people to look at, to review. We want to make sure that you see that you get outcomes for the dollars that we're going to get, that are being given to us for, to be responsible for. We absolutely are committed to that. And also committed over the next several months as we develop policy to work with community members to make sure it meets those needs as well.
Thank you for your hard work.
Thank you. Thank you.
Councilwoman Green.
Good afternoon. So public meetings are always to address public concern. And so I want to get some clarity on some things that were stated today for the purpose of the public. Mr. Gissel, you stated that, did you give us a timeline of when an actual report would be given?
We think we'll actually have a CEA probably within 30 days for
so
the council to
30 days would be the CEA?
Right.
Okay. And then I heard about the de facto board that is now the official board. And somebody from, I guess, the agency maybe who was just speaking could come forward. Will the board change again at any time soon? And will there be some type of written document that would hold that board in place so we'll know their tenure, if it's staggered or if it's straight 2 years?
I'm hoping I'm stating this correctly, but maybe you can help. The term of the board members, 2 years. That's what I thought before I said it. There's a 2-year term when somebody's appointed on the board. So we are committed to that 2-year term for those individuals. People, though, can be reappointed and more than likely will be reappointed. We do still have one vacancy. We have 20 members that are according to our bylaws we can have. We have 19.
That's what I was asking. So there is a
So
bylaw.
there is, yes, we have bylaws that allow for 20 members for the 2-year terms. And again, our hope is that, as these members contribute to the board, as long as they want to and are contributing members with the expertise we need, that they will continue. But some people will, of course, drop off, and we'll have to get additional members as those individuals.
When you talk about the bylaws, is that public information?
Yes, I'm certainly. If it's yes, we can get our bylaws.
So I can get a copy of the bylaws.
Sure,
that would help as well. So just maybe that will help me on operations and and some
Certainly.
of the ways you guys will be handling that. You also spoke about the expertise. You said we had some board members that were on there, but then you wanted more clinical experience. And I think
Correct.
that's great because practicality and actual education or studying academia versus practicality is also very different. So I'm happy that we have some people that have clinical experience on there. There is still a question about the timeline. I know we levy the tax today. When will the money start coming?
Not till January of 2020.
Okay. And so we're looking at about 30 days for the CA. We're looking at about a year or so for funding to come in. And then at that point, from the 30 days to the funding coming in, I'm sure that the board would have met to provide more information about how the operational budget or something of that nature.
One of the things that I mentioned earlier is we established a community relations committee is going to give.
Let me ask you this.
Sure.
The community relations committee is different from a board of directors.
Yeah, but they're members of the board. They're members of the board.
It's a
subcommittee of the board.
So are they handling operational budget? The subcommittee?
Well, there are several subcommittees. Finance is one of the committees
that will handle that.
So yeah. So what the idea of the community relations committee is that as the operations committee moves forward with decisions that are approved by the board, as the finance committee gets a potential budget and approves that, and the board approves that information then is channeled to our community relations that will give public documents about what's going on and the progress as we move forward. The board meets every 2 months right now, is the schedule that the board has for right now. Our subcommittees are meeting pretty often at this point to try and again get moving, because even though we talked about the money coming in January, we're hoping that we may be able to get through private donations or other sources.
And that's fine. I guess my concern is still trying to understand how we're going to get to full operations. And so goes back to this bylaws that we're talking about. And so you stated that, I'm assuming all these subcommittees are in the bylaws, right?
No, they're not. These are subcommittees that are just by the board. They're all board members. Everybody on the subcommittee is a board member as well. Okay. And but they are in our minutes. We determine those in the minutes.
Something about minutes.
Councilwoman Green, you want your
yes, ma'am. Okay. So something about minutes. We got a request this week for minutes for the RDA board meeting, and quickly, Councilwoman Fryeburg and Councilwoman Banks, I think, sent it out like, hey, can we get those minutes uploaded? So will they be uploaded somewhere?
I'll ask that. Yes. We can do that.
And it may seem crazy.
I want to give as much information
as where I'm leading all these questions coming from, so that I can, and the news can articulate to the public that it's some visibility somewhere that you can see these things. And then we talked about funding sources, but you said that would come through one of those finance committees,
right. Again, the idea is to have a finance committee that will look at some of and part of that will depend on when we think we'll start, and also what a provider can do and how soon they can do it, as well as what it would cost for those startup costs.
I'm happy you said that. So the other question I had a blank. You have been talking with a provider. You said, I couldn't remember the word you used.
Well, we have been talking with a number of providers. For instance, St. Tammany.
So you when you stated it, you made it seem like it was some type of study you were doing studies with different people. So is it one provider that's doing like a study around the country? Who is that?
Let me clarify. First, HMA did a report in which we looked at providers and things that were done around the country. Emergent Methods also did a follow-up study doing the same things, talking to providers as well as around the country, as well as locally, about developing our business plan. When I talked about, and I don't remember what part of your discussion.
Pre-election or
pre-election. These are all pre-election. Okay. Post-election, we have, through our operations committee, we are now exploring what's out there. So that, again, we can develop a proposal to meet all the objectives of our business plan. I've spoken to St. Tammany, who is also an entity. They put out an I don't know if it's an RFP or request, or I think it was an RFP they put out specifically for their crisis stabilization center, and they have a list of providers they looked at, and again gave us
checking best practices,
checking best practices through all these different entities, both locally as well as nation.
Thank you for answering my questions today.
Thank you.
Councilwoman Banks. Charlie, turn your mic on.
Is it the city of St. Tammany that
It's the parish, the
Okay,
St. Tammany parish.
Daryl, please. Okay. As I know you said the draft will be ready in about 30 days. I think in conversation with the mayor, she was going to make sure that we see the draft before it's brought before the council, and take whatever recommendations that we have. One of the questions, what is the criteria that the mayor's office has developed to decide what entity they should enter into a CAA?
Well, we've actually been working with so far the group that put the measure forward. So it's been the Bridge Center Board that's been working in terms of trying to help put together a CEA.
Okay, so, but in that, the consumer, the taxpayers was not, did not know that it was going to automatically go to one individual. I'm sure the premise was thinking that the city would run it. But so still you have to have a criterion. So what is that? I understand whether you worked with the bridge, you still need that. So what are those things?
I think it really has just been the board that brought the measure forward, is helping us put together the CEA, and then they'll come back and say, here's what we'd like to put forward, whether it's the board saying they're going to contract with the city, or if they're going to do an RFP or whatever to find the provider.
Okay. Do you think that's somewhat narrow? When we think about what we're dealing with?
I think when you look at where we are just as a council or as a body, the question is who puts that package together?
Right. And so based on it could have been the council, since basically we're in control. So the council could put together, or the mayor's office, and I guess we're delegating it to the mayor's office, which is fine, but so that's the person who is responsible, irregardless as who she consulted. What I'm asking is, again, what are the listing of criterion that you will use? Because it's if you use the same entity you're considering, then that's kind of bias and that's prejudice. Right. So what general ideas that you went into saying this is what we're looking for, best practices?
I think when you look back at the history, there was a proposal back, I guess, in 2016 or 17 that was the, quote, Bridge Center. We have a contract with the Bridge Center to run that small program that we're doing with the city, and this is just kind of a continuum that's going on from that.
So the contract listed that this was a continuum?
The one that we have right now is actually a contract in the budget with the Bridge Center.
No, the one in 2016.
The 2016 was the first proposal that didn't pass.
Right. So that meant that's it. So
right. And then I think when it came back before the council, the Bridge Center really was the group that everybody talked about that was bringing the measure forward.
I never heard the Bridge Center until this year.
Right.
So that's not true. I'm not sure who told you that. The other thing, you are talking to a mental health professional. I also have a sibling who's a licensed clinical social worker, and my mother was a counselor. I see not only for over 25 years, I know this population. I know what works and I know what doesn't work. So I could come up with a criterion. But, since y'all getting paid the big bucks, I would like to see that this week. Some of the things, I think none of the issues have to do with the need. But I think when we think mental health issues, we're talking, and we think about even the persons that representing, when you talk about a board, you need representation probably from the National Association of Social Workers. You need representation from the Louisiana Professional Counselors. You need people from the DA, from the public defenders, capital area, law enforcement. You could have one, but But a lot of, and you need someone from the council since we're responsible for the people's money. So in doing that, I think those are the kind of questions, and that's the kind of report, I'm not going to speak for my two council, but I assume that's what they were talking about. And so when you bring the report back, that's what we need to know. We need to know from the mayor's perspective, because that is her obligation. Her obligation is not to the Bridge Center, it's not to BRAF, it is to the people that voted for this tax, thinking the right things are going to be done, and that it was going to be people-driven. So we've heard a lot about a business plan, but what we haven't heard about is a mental health management plan. And so, yes, if you're dealing with...
Councilwoman Bates, let me give you your other 5 minutes.
Please. If you're dealing with, BRAF or a Bridge Center, yes, that's all you're going to hear is a business plan. But what I need the mayor to enter into a CEO is with someone that has a behavioral health plan, like the lady said, St. Tammany. They put out an RFP with a mental health facility. There's no licensing. This is just a dream. The Bridge Center for Hope is a hope. It's not actuality. We got real people money that we're trying to get with a dream. And that's not right to the people. And so those are the things that I am concerned about. If this was a licensed facility, if they had gone through all the things that are necessary for licensing, even if that was an application, there's not even an application at DHH for this. So it's like crazy for us to be putting all this hoopla into something that does not exist. So that's what I would like the astuteness of the mayor's office to work towards. I like her and this administration to start, stop acting like we're dealing with one entity when you are dealing with all these people who are looking for. And then who is going to talk about children, who are going to deal with youth, who are going to deal with families in mental health, who are going to deal with seniors. All of those populations have the potential to go to jail. Right. The number one reason, according to research, is not because there's nowhere to put people, it's due to noncompliance. That is what causes people to be in crisis for mental health, not because they don't have anywhere to go. So we have to look at mental health from a continuum of age, and then we can't take people on my East Baton Rouge Parish tax dollars, take care of mental health people in Ascension, Livingston, and all these other places, but we won't take care of our little babies in East Baton Rouge Parish. That's crazy. We won't help the children here, but we're going to take care of adults in another area. So we got a lot of work to do, and, I appreciate the Bridge people. I do. But they need to be able to do that out of their hearts, not based on this money, because I think it would be a shame and a lawsuit to move forward with a CA, with an entity with nothing but a dream. Thank you.
Thank you.
Thank you. Councilman Watson.
I first want to say thank you very much, Erica, for bringing forth stuff to ask for, financial responsibility on their part, having clarity in the cooperative endeavor agreement, and everything you've asked for I think is very reasonable, and I think Kathy Kleber is going to make sure that we get that, or someone from BRAF or from the board is going to make sure that we get that. And if BRAF is the organization that was able to get us organized to come up with this tax and get it passed so we can get something that we desperately need, then good for them. Thank God. I appreciate it. And as much as y'all been getting a little bit of hell in some emails lately, I want to say to everybody here that worked to get this tax passed, and every one of y'all that are volunteering your time to be on the board, thank you from the bottom of my heart. I really appreciate it. That's all I got to say. Have a great night.
Okay, are there any other council members? Darryl, I still think that one of the things that we were looking for tonight, and they probably could have done with if there had been something presented in the CEA, is something in writing, something to look at, something tangible. So we were told we're going to have it this time.
We actually just have a draft right now that needs to be reviewed and needs to go through parish attorney's office.
Okay. So who are the
council? And it will come back to the council.
Who appoints members to the board?
In this case, it actually is their bylaws that would cover that.
So yeah, you can come on up. Okay.
Again, we have in the bylaws the number of individuals. Mm-hmm. We have a nominating committee as part of the board that receives recommendations. For instance, we just recently received 10 recommendations that we reviewed. The nominating committee reviewed and then made a recommendation to the entire board, who then vote on those slate from the vote approvals.
So who can submit names for recommendations?
Anybody can submit names for recommendations. We took names from various entities and individuals.
Okay, so just going back to the financial part of it, was there any anticipation of bonding any of this money to have resources before the actual funds are realized?
I'll let you answer.
We think there may be a way. We've had initial conversations that there may be a way to do some things through financing where we could do a loan. There may be some different options to get a program up and going faster.
So does the Bridge Center plan to RFP any of this out, or is it just how is all this going to flow?
Well, we need to have an entity that has, as Councilman Banks said, an entity that has experience in doing this. So the plan is, after we talk to a slate of providers, to develop a proposal that we can have people respond to, and then make a decision in terms of using that entity. And it could be one all-inclusive provider that could provide the whole array of services, the whole continuum. I mean, because we have, like I said before, anything from crisis, from mobile assessment all the way to case management at the back end in terms of follow-through. Or it could be several entities that would provide those.
So the understanding tonight is that it's not the Bridge Center who's going to be doing the providing of these services. That's kind of a part of the confusion, is that you guys are going to get the money, you guys are going to provide the services, and what I believe Councilwoman Banks is saying, the experience is not there for the Bridge Center. So that's one of her concerns. So
again, we have the experience to manage those services. Okay. That's, again, I think everybody wants to get an entity that we feel comfortable. We could go and get an executive director, a clinical director, and do this as well. At this point, and again, there's a lot of decisions that haven't been made yet. There are a lot of decisions that have not been made and are all part of this operational committee looking to make sure that we have providers out there that could do it. And again, if that didn't work out, then we would look at having an executive director, a clinical director, and hire these individuals through the board.
So again, everything that you guys have come up tonight and shared has been concerns from the public that had to been put in writing. People could better understand the flow of what is going on, a timeline for what is going on, making sure that there's accountability, because that's what people want to know. They want to make sure that those things are in place. And right now, I think for everybody, it's sketchy. It's all over the place. People don't have a really clear understanding of how all of this is going to flow and how the money is going to be accounted for. So I think that's a continued concern.
I totally understand that. And again, that is part of our plan, to be able to do that, to put a document in writing to the public in terms of progress and where we are, so people understand the flow.
Okay. And so I think that just the mere conversation of the cooperative endeavor agreement makes it seem like you're going to bring it to this body and then we're going to agree to it and that's going to be it. So there seems that there's a lot of conversation that still needs to be had about what the plan really is going to be to implement this whole process of a substance abuse mental health facility.
And understand that while we've done years of work to get to this business plan, there's still, when you get to operationalizing a business plan, there's lots of decisions that have to make. We're early in this process. And again, it's not like we're making decisions and just not telling people. This is all part of a normal process of, you have a business plan, you get funding, and you start operationalizing. It's a long process to get through.
I understand that, but I think that open communication helps the public feel more, I'm not going to say comfortable, it helps them to be able to better explain. I know Reverend Anderson has a group that she works with, and everybody in here, Jennifer, different people have, Dr. Stewart, different groups that they're working with. And so if the public cannot go back, and from a council standpoint also, if we can't go back and explain to people in the public exactly what this process is, then it's not clear for me, then it's not a comfort zone for people in the community. They're like, you're just sitting up there signing off on stuff, you don't know what's going on. So there has to be some accountability and some understanding first for this body as to how this is going to roll out, and then so that the public has a buy-in and understands it also.
No, and I understand that as well. You know, we want to make sure that people have every bit of information that we have.
Okay, thank you.
Thank you.
Any other comments from the council? So I'll make a, Tara, you had something? Let's see. Okay. Been moved by Councilman Hudson, second by Councilman Watson to receive the report. Are there any objections? Seeing none, the report has been received. Is that it? Motion to adjourn.
Before we do a motion to adjourn, we want just a little point of personal privilege, Councilman Walsh and I. We just want to, first of all, wish everybody a happy Valentine's Day. Of course, we gave all of our colleagues a little box of chocolate, and Trey has a quote that he wants to read, and we gave everybody some cookies. We just want to remind everybody to love one another, and we try as best as we can to make sure that we live it. And I'm going to say this myself: confession is good for the soul but bad for the reputation. And so today we were in a meeting, and y'all know sometimes they get passionately charged, and I yelled at Councilwoman Banks a little bit, and we got passionate. And so I just want to say, I love you, and I do apologize for allowing myself to get passionate. I don't want to be hypocritical and wearing my love shirt and then I'm hollering at people. So I just want to say I love you, and I apologize for getting mad. But we do want to just wish you guys a happy Valentine's Day, and at the end of the day, make sure that we remember to love one another. Trey, you want to?
Yeah, so, one of the things is I think everybody got a heart-shaped chocolate box, and we've got, some Valentine's Day stuff, which reminds us all of love. And I was talking about some stuff, Tara and I, and, it was one quote that stuck out at me before. No, I'm gonna read it. And so the thing is one of my favorite ones was, only light can drive out darkness. Only love can drive out hate. Hate only begets more hate. Hate feeds upon itself in people's hearts to the point that, left unchecked, it's going to consume all, and all it does is hunger for more. I'd rather live my life on my terms and love people than try to live by others' whims and constantly chase my own tail. Now that's a bunch of things all together, but at one time is that this journey that we've been on, I'm telling you, I've learned so much, and I learned that so much more needs to be learned. And the more we hold things in and try to not realize that we can just love one another and not necessarily need to be loved back, I'm fine with. So happy Valentine's Day, everyone.
Happy Valentine's Day. Y'all join us for our monthly talks. Thank you.
Just one announcement.